Okay, Jake, for this portion of the physical assessment, I need you to take off your t-shirt, so if you can do that for me. What I'm going to do is have a look at your chest structure, so I'm actually going to be looking, and then I'll be touching and just making some notes from that as well. So in looking at your chest structure, there is symmetry noted. Your clavicles are aligned. Your sternum is midline. The symmetry of your chest is noted as well. You have no lesions or any kind of bulges or masses that I am seeing. I notice you do have a scar on your left side, just at the anterior portion of your shoulder. You have the normal male pattern hair that is noted on the chest and the arms, and down the midline, the front of your chest as well. I do see your skin is clear. Besides the scar, there is a little bit of acne noticed on that right side. And in looking at your respirations are smooth and even. Okay, Jake, I'm just gonna put my hands on your chest for a minute just to touch you. Is there any tenderness that you feel when I do this?
Nope.
Okay. So again, I am not feeling any bulging. I'm not seeing any masses or feeling them. No tenderness in the chest.
Nope.
Okay. And no tenderness in the neck, down
Nope.
into this area. Okay, great. Now I'm going to go from behind, and I'm just also going to do something similar just in touching you as well. What I want you to do is lean forward just a slight amount. That's great. And I want you to say 99. What I want to do is just feel if I can feel a vibration when you are doing that, okay?
Okay.
So you can just start now. Say 99.
99.
And again.
99.
And again.
99.
And again.
99.
Good. Now I'm going to use the palmar surface of my hand, and if you can do that again.
99.
And again.
99.
Again.
99. 99.
Good. And there is tactile fremitus noted. I can feel the vibrations. Okay, and if you just lean a little bit more forward, I'm going to go down just to the 10th rib. And I want you just to take a deep breath in. Okay, good. And let it out. And I do notice that there is thoracic expansion and it is symmetrical. And if you just do that again. Very good. Okay. Now I'm going to do something that tells me the how your diaphragm expands. It's called diaphragmatic excursion. Okay, and it's just going to be a measurement of your diaphragm. If you just lean forward, put your arms around the front of yourself. Yeah, just like that, and lean forward a little bit more. Okay. What I want you to do is I want you to take a deep breath in and hold it for me. Now Jake, take a deep breath in. This time, you're going to let it out and hold it when you let it out. Okay, good. And I'm just going to measure that area. It should be between 3 to 5 centimeters, which it is 4. And that is normal. Okay, great. I just want to listen to your lungs, Jake. Just take a deep breath in for me and out. Just breathe normally. Good. If at any point anything is uncomfortable, let me know. Deep breath in and then out. And in and out. And in. Good. Okay, great. And if you could just place your hands on your head. Sorry, your hands on your head. Yeah, that's great. And just a deep breath in. Good. And out. Okay, and then you can just drop your hands. Okay, great. And you have clear bilateral sounds, and no adventitious sounds are heard like rhonchi or rales. I just want to have a listen to your trachea. Good, and no bruits noted as well. Okay. Jake, at this time, I'm going to do the cardiovascular portion of your physical assessment. And again, I'm just going to start by looking at your chest structure. And so in looking at your chest, I noticed that the skin color is even and it's the same color as your neck and face with pink undertones. There are no heaves or lifts or thrusts when you're breathing. Your respirations are smooth and they're even. Any pain at all when you breathe?
No.
Okay. I'm looking again for chest expansion, and I see that, and it's regular as well. I'm looking also, just in considering the heart, there are other things that you look at, one being the eyes, and so there's no distension or protrusion of the eyes. In looking at your neck, I do not see any distension of the jugular vein or the carotid arteries. There are no noticeable pulses that I'm noticing in the chest area as well. And I'm just going to have a feel for your carotid artery. And I feel that one. Okay, and there's the other one. Both of them are equal. Both of them are strong, not bounding. And so that's a normal pulse in the carotid area. I am going to now just palpate the area of your chest. Again, any tenderness?
No.
Okay. And I do not feel any pulses. Now I am going to go down to your fifth intercostal space. And I do feel a small tapping sensation. That's where the PMI is. That's the maximum point of impulse, just at the lower part of the heart, the base. And I do feel that. It's just a small tapping sensation. No bounding, and I don't notice the pulse on its own. I'm going to have a listen for each of the areas. I'm going to go first to the second intercostal space. And again, the pulse is even. soft tapping. And this is the area where S2 is greater than S1 in terms of what you hear. And then going over to the left, second intercostal space. Again, S2 is greater than S1. At the third intercostal space is Erb's point, and this is where S1 is equal to S2. The left fourth intercostal space. This is where S1 is greater than S2. And similar in the fifth spot, and this is where the PMI is. S1 is greater than S2. No murmurs noted. Your heart rate is regular. Okay. So I've listened to your apical. I've had the carotid pulses palpitated. I've palpated them. I just want to feel your brachial. Radial, sorry. Good. Okay, and your brachial is just a line up from your pinky. Okay, and I feel that one. And again on your right side. Okay, and I feel that. And now your popliteal requires both hands, and I'm just going to go in. You relax your leg, just like that, and I'm going to go in. It takes a bit of force just to push in to feel that pulse. Okay, and I feel that with my index finger. And I'm going to come over here and do the same. Okay, great. I'm just going to take off your sock for a minute, Jake.
Okay.
Because we're just going to feel the tibial. The tibial, if you get your ankle, it's just below the ankle. Okay, and I feel that one, and I would feel that on the same side. And then the dorsalis is just right in the middle of your foot, dorsalis pedis. Okay, and I feel that too. So I'm feeling all of your pulses. Everything feels even, regular. Nothing is bounding, but they are strong. Okay, so that's the cardiovascular. And next we're going to move to the abdomen, and I'm going to get you to lie down.
Okay.
Okay, Jake, so we've moved now to the lying position. I am going to have a look at your abdomen along with listening and palpating, okay? Do you have any pain in your abdomen ever?
No.
Okay. In looking at your abdomen, your skin is even. It is positive for respirations. It's positive for striae. I see some striae just on the right lower side. That would be your upper right quadrant. It is positive for pulse, I can see as well. It is negative for masses or lesions. It's negative for peristalsis. And it's negative for any lesions. I notice as well the hair distribution is normal for male, and it's the same texture as on your chest. In looking at your umbilicus, it's inverted. I'm going to place my hands just around there. Is there any pain around the umbilicus?
No.
Okay. And I'm not feeling any herniations, any massing or bulging. Jake, I'm going to have a listen now to your bowel sounds. Good. And so there are bowel sounds present in all 4 quadrants. I'm just going to have a listen now over your liver. And then over your spleen. Okay, and there are no friction rubs heard over the liver or the spleen. I am now just going to have a feel and palpate each area. Is there any tenderness over this area?
No.
Okay. And is there any tenderness over this area?
No.
Okay. I'm just going to have a listen. So dullness heard just in this area where the spleen is. Your spleen is just under the intercostal muscles. It's under the intercostal space, under the rib area. And there is dullness heard where the liver is. In a minute I'm going to measure that. And dullness heard over the bladder. Okay, now I'm going to measure your liver, and I'm going to do that by starting at the top. Actually, I'll go from the bottom where there. Let me get my pen. Here we go. So I start from the bottom, where tympany is heard to the dullness area, and then from resonance down to dullness. And that gives me an idea of how large the liver is. And yours is 9 centimeters, which is normal. Now what I'm going to do is just palpate the liver, okay? And you don't need to move at all. I'm going to put my hand under. And I want you to cough for me. Okay, good. And the liver, I do feel it's very smooth. I can feel the edges of it. The spleen is not, we're not able to palpate that because of where it is located. We would be able to palpate it if the spleen was enlarged. And then finally, Jake, I'm just going to feel your kidneys as well. I'm palpating them. And they are retroperitoneal. And I can feel that. Is there any pain when I do that?
No.
Okay. And again, I'm just going to feel the back part over here. And any pain in the back?
No.
Okay. Okay, great. That concludes our abdominal assessment of you. Thank you so much.
Welcome.